Thank you for attending Chapter 3 of the series on the history of breast cancer surgery by Just Medicine. We have presented, chronologically, how medical science has guided doctors to adopt changes in treatment recommendations and trust that this would give patients the confidence to make the right surgical treatment decisions for their specific condition. As this is an educational video, there will be references provided along the way for you to verify the facts presented. Please note that this information is not intended as a substitute for a surgical consultation, and patients are encouraged to see their doctor for appropriate treatment planning. We have seen that it took rigorous research and careful analysis to introduce a new mode of treatment into clinical practice, which was significantly different from the prevailing standard. It was through their tireless work that visionary surgeons, like Professors Veronesi and Fisher, were able to achieve a paradigm shift in therapy with less extensive surgery for equivalent survival outcomes. By the early 1990s, breast conservation treatment was accepted as a viable option for the treatment of early breast cancer. We now move on to discuss how the integration of various elements from the 1990s to 2007 allowed further progress in breast cancer surgery. Various healthcare organizations and government authorities implemented policies to make cancer registries possible at different times in the 20th century. For example, the Swedish Cancer Registry was established in 1958, and the Surveillance Epidemiology and End Result Database was initiated in 1973 following healthcare legislation in the United States. Of interest, Australia began a registry specific for breast cancer in 1991. The development of information technology made the storage and analysis of registry data less tedious. Its continued growth meant that analytic capabilities concomitantly increased. This allowed complicated analyses of large volume of data accessible. The growth of the Internet also facilitated collaboration and dissemination of information. We will recall that the Milan 1 study analyzed 701 patients, while the NSA-BP-B06 trial evaluated 1,843 women. In total, the combined number of patients in these landmark studies added to 2,544. This number was considered adequate to achieve a paradigm shift in the surgical treatment of breast cancer. This study by Dr. Martin spearheaded another change in philosophy in respect to breast cancer surgery. The availability of a cancer registry, in this case the Western Australian Department of Health Record Linkage Unit, made data analysis of women with breast cancer from the entire state possible. Information could be collected from the registry and subjected to analysis with a software program. The researchers managed to obtain the records of 3,000 women from the registry who were treated between the 1st of January 1995 to the 31st of December 1999. Eventually, 2,787 women from this patient cohort met the criteria for inclusion for analysis. What was remarkable about this study was that the data analysis showed that women with early breast cancer treated with breast-conserving surgery had improved survival outcomes when compared with those who underwent mastectomy. This was, of course, different from what had been reported from all earlier studies, including the Milan 1 and NSA-BP-B06 trials. In the two prior decades, it had always been thought that breast conservation treatment and mastectomy provided equivalent survival. This is what makes the Western Australian data stand out. It is also noteworthy that the cohort of patients analysed in Dr. Martin's study was greater in number than the combined total of the two earlier landmark studies. In addition, these results were reported in a real-world setting rather than within the confines of a research trial that the Milan 1 and NSA-BP-B06 studies were subject to. As we see in this table reported in Dr. Martin's study of 2007, mortality or death as a result of breast cancer for women who underwent a mastectomy was 14%. After breast-conserving surgery, mortality was 4%. This difference was statistically significant. However, in this study, the median follow-up was 1,173 days, or 3.2 years. Hence, it may have been considered to have fallen short of an adequate period of follow-up. Still, this was one of the earliest studies to provide clues to the direction that the surgical treatment of breast cancer was to take in the coming years. It is evident that any surgical treatment for breast cancer has been rigorously evaluated before a recommendation is made. In 2007, the data was already in favor of breast conservation treatment instead of mastectomy for early breast cancer. We will delve into the hints that were provided in the Milan 1 and NSA-BP B06 trials in the bonus video. Subsequent to that, you may wish to join us as we present the evidence supporting current surgical treatment of breast cancer.